Prof, good morning, and thank you very much for your time this morning. I just got one kind of important question to ask this morning as we begin. Are these numbers correct? I mean, last night, Dr. Zweli Mkhize, tweeting just around ahead of midnight yesterday, tweeting, and I'm reading the tweet, as the National Department of Health, we've identified there's a need to reconcile data in Gauteng province. We've brought this to the attention of the province, and they've indicated that they're in the process of harmonizing the data. That's the English that's being used there by Dr. Mkhize. And he says, for this reason, we will not be reporting the recoveries and active cases. I mean, active cases of less than 350 people or so in the province, which is the largest province population-wise. What is wrong with the numbers in Gauteng? Is there something wrong with the numbers?
First of all, thanks for having me on this occasion, and I'm very happy that these questions are raised and we can have an open conversation about them. Let me briefly summarize about the status of data collection and data analysis and modeling in the province, which we follow very closely on a daily basis. Now, the short answer to your question as to whether the numbers are reliable in regard to the total number of people infected, the answer is yes, we believe they are reliable. The data flows and the streams of information, the streaming of information is actually quite sophisticated by now compared to back in the day before the first surge. The data is scrutinized pretty heavily by quite a number of people. Not just the number of active cases, but also the number of hospitalizations, different kinds of hospitalizations, mortality, and so on and so forth. The way we look at the data is now relatively sophisticated. We rely on sophisticated methodologies such as artificial intelligence that allows us to understand deeper the dynamics within the data. One of the things that we monitor very regularly is basically the development of hotspots. So if there were indeed a surge going on in Gauteng, we would have already found out weeks ago.
But how
developed in addition?
Yeah, but Professor, one would respect that there will be a proper system set up to do exactly what you are explaining there. But just at a normal, ordinary level, how would you explain this? The DA's Jack Bloom issuing a statement, and now the Gauteng COVID-19 numbers are being described as fake figures. And he says, according to the latest National Health Department, there are only 283 active cases, okay, in Gauteng. How is this possible when the NICD has reported there are 1,624 COVID-19 patients in Gauteng hospitals? So are there 1,624 cases, 1,624 cases in hospital according to the NICD? And then if there are, why are there only 283 active cases?
Okay, let's separate the issue into two. There are technical issues sometimes when how people count active cases. That's a separate issue. Let's look at the bigger picture here, which is the number of new cases daily, number of hospitalizations, and so on and so forth. Now, in order to explain why the numbers of Gauteng are relatively lower now compared to other provinces, which in fact was the case in the beginning of the pandemic, one has to look at other sources of data. For instance, mobility. We do an extensive survey of mobility of people in the province and across the province using data from Google, Facebook, and Apple. That allows us to conclude that in the past few weeks, there's certainly been a decrease in the mobility in the province, which can be attributed to different factors. Also, one has to take into account that we're approaching a season in Gauteng where there is a lot of outgoing mobility of people going away from the province and reducing further the mobility in the province. And mobility, people have to understand, is absolutely essential to the progression of the pandemic. Mobility basically drives the numbers. So the fact that we have relatively low numbers of active or relatively low numbers of new cases. Let's focus on the new cases. Let's not get into the technical question of how sometimes people compute what is an active case. Let's look at the numbers of new cases and number of hospitalizations.
Prof, yes, new cases are important. We understand that. But when we hear the word active cases, those are the cases that will be up and about carrying the coronavirus. We are trying to avoid a second wave in this country. We are told we need to behave. When you hear that the number of reported active cases in the most populous province and the most economically active province of the country, Gauteng, is actually lower than it's been recently, and then we are told that there's 1,600 and odd patients, but the number that is given is lower. We have to worry because we don't know now what to believe. What are the accurate numbers? I think that's what is at point. From where you sit as the advisory committee to the Gauteng Premier, are you satisfied that we are getting the accurate numbers? The government has now decided to suspend reporting on Gauteng's recoveries and active cases because surely there's some discrepancy somewhere.
Right. As I said, I had to go back to my original point. The way we, people of the province calculates active cases is something that can be debated. But what is important to understand the progression of the pandemic and the risks for a second surge comes from the number of new cases, hospitalization, et cetera, et cetera. I know that for the press and the public, it's also important to look at the number of active cases, but that number is derived from the important numbers, which are the number of new cases, hospitalizations, mobility, and as such. So as such, as a committee, we are following closely the situation. The situation in Gauteng is currently under control. However, that does not mean that we will not have a second surge, especially when large amounts of individuals that have traveled outside come back. And that's, to us, the biggest worry that we are now grappling with and that we're working on very carefully. We're now undergoing a very detailed study of the modeling and the projections for when a lot of people come back to understand how to react to that. But I would not really worry too much about the fact that there is a technical issue pertaining to the calculation of active cases. As I said, active cases is a number that comes from all the numbers, the important numbers that based on which we can conclude as to where the pandemic is are under control. And at the moment, the numbers are reliable.
Now, those are the new cases. And now, can you tell our viewers that in terms of new cases in Gauteng, is it getting better? Are we getting worse? Are the numbers of the new cases in Gauteng that you and the Gauteng Premier's Advisory Committee are aware of in Gauteng under control, as you say? Or are we beginning to see an increase already in the numbers of new cases in Gauteng?
Right, so that's a very good question. So the Gauteng province, up until about 3-4 weeks ago, was basically totaling around 1,800 to 2,000 cases a week. Because of what I just mentioned, the decrease of mobility, in the past 3 weeks, we're basically averaging below 1,500. So the number of new cases has dropped. So when you do a detailed study of the correlation between the number of new cases and mobility, you realize there's a very strong correlation. So we can explain the fact that the number of cases per week has dropped with respect to a month ago to the fact that people are now driving less or they're engaging in mobility less compared to about a month ago. So this is perfectly natural. And we expect these numbers to remain more or less stable till probably January. And as I said, our biggest concern really is what's going to happen and how to deal with the situation when large amounts of people from other provinces will come back to the province, bringing the virus in large numbers. And that is, to us, the biggest concern.
Okay, final question to you. The National Department is waiting for the reconciliation in terms of recoveries and active cases in Gauteng. That's why we're talking to you this morning, because those have been suspended. There are big question marks at those. Are you now going to be telling the Premier of Gauteng to ask the Department of Health, ASAP, to come out with those numbers so we are all assured that Gauteng is not hiding anything?
We have communicated that issue, obviously, to the Department of Health. We've looked obviously at the numbers, and we are very much aware of the fact that there is a technical issue pertaining to the calculation of recoveries, which, as I said, is not critical to the understanding of the pandemic. So at the moment, the numbers are under control, and this technical issue pertaining to data flows, of course, have been brought to the attention of the relevant individual.
Thank you very much, Professor Bruce Melado. He's a member of the Gauteng Premier's Provincial Advisory Committee on COVID-19 and also forms part of the team that does the modeling. He's saying the number that we should worry about, concern ourselves about, is the number of new cases in Gauteng, not recoveries and not active cases, which currently are being questioned